First, infections from the Omicron variant of Covid-19 are continuing to multiply rapidly across Europe, the US and Asia. All of this in the run-up to Christmas, and that's thrown the travel plans for millions of people into chaos. Well, Germany, Portugal and the UK are amongst the countries reported to be considering further containment measures, whilst Thailand has reinstated mandatory quarantine for foreign visitors effective today. Well, the Omicron variant was first detected last month in southern Africa and in Hong Kong, and so far it's been reported in at least 89 countries. Well, the British Prime Minister Boris Johnson says his government is looking for all kinds of measures to keep Omicron under control. This as the numbers of Covid-19 infections surged to their highest levels ever. And that's raised concerns that hospitals and other emergency services could soon be overwhelmed. Well, for more, we can speak now to Paul Hunter, Professor of Medicine at the Norwich School of Medicine, which is part of the University of East Anglia. Thank you so much for joining us, Professor. You're a government advisor and an expert on infectious diseases. Lots of governments around the world are confronting similar dilemmas, but do you think the British government will and should shut down before Christmas?
I don't think we will, and to be honest, I don't think we should. If you look at the last few days, yes, Omicron was increasing, doubling about every 2 days a week ago. But over the last 4 or 5 days, it seems to have leveled off and maybe even already falling. So it is, at the moment, a very difficult situation to work out. It may well be that we might be past the peak, but I think we need to wait a few more days yet before we can be confident about that. But it certainly doesn't seem to be increasing at the rate that it was even a week ago.
Okay, are you hearing from your colleagues who work in emergency rooms around the country that for now ICUs are managing to cope with the influx of patients?
Yeah, I mean, if you look at the data, the national data for intensive care units, it's pretty much the same level that we've had COVID patients occupying intensive care beds now for 3 months. There's not been any obvious real increase in ICU bed occupancy. So at the moment, we're not seeing a huge increase in hospitalizations, or indeed in the most severe hospitalization cases, the people that need intensive care. That is what we saw in South Africa to a large extent, and what is already being reported by a number of other European countries, that they're not seeing that same sort of pressure at the moment.
And do you think that's partly because the United Kingdom carried on for quite some months, even in the build-up to the arrival of Omicron, of allowing there to be higher numbers of infections circulating? Masks weren't commonly used in public transport. Well, they weren't compulsory at any rate. Do you think that perhaps has helped the UK to perhaps stave off the worst of it? Because, of course, that was all happening not during the winter months, but during the time of the year when perhaps these things are a bit less deadly.
Yes, indeed. And in fact, back in July, I think I wrote for the Science Media Centre that one of the advantages of opening up in July is that we would have more cases in the summer when we were better able to manage them. And that may well have been what we're seeing here. What we do know as well from studies is that if you've had COVID already, you are still very much likely to get Omicron. And if you've only had 2 doses of vaccine, you're still quite likely to get Omicron. But if you've had a booster, or if you've had infection and vaccine, then both of those give you quite a lot of good protection. And we in the UK, we've certainly got a lot of boosters, but we've also got a lot of people who've had COVID and been vaccinated. So I think we have quite a substantial proportion of the population that has already got some pretty good protection against Omicron.
OK, well, that's encouraging. So despite the faster spread, perhaps, as you say, less serious incidences of illness amongst people who are infected. Let me just ask you lastly, people who are thinking of holding Christmas gatherings, perhaps scale down office parties, what would you advise people, it doesn't have to be in the UK, but anywhere, how they could perhaps minimise the risk, mitigate those risks?
Yeah, I think the risks are always when you've got large numbers of people indoors. So in my own university, we didn't have the big faculty Christmas party, but there wasn't any reason why small groups of people who generally work together could not sort of have a small celebration. And I think that substantially reduces the risk. Gatherings in people's homes probably aren't that much of a risk, providing that they're not too large. And in fact, studies that have been published over the last 6 months or so across Europe suggest that gatherings in private homes aren't a major driver of transmission compared to gatherings in other environments where you've got lots more people who to mix with. So ultimately, I think we can enjoy Christmas with our family without being too concerned. But if you're sick, if you feel you might have COVID, check yourself before you go and stay with your elderly relatives.
And just lastly, sorry, this is my very last question. 10 seconds. Are you going to make your guests test before they come round to your house for Christmas?
No, because we've been having that they're all well. If they are ill, they are going to test before they come. But everybody in my family has already had 3 boosters. So I think we have a degree of protection that I think we're comfortable with.
Thank you so much. Thank you for your time, Professor Paul Hunter. Thank you very much indeed.